So if by any chance you need to leave halfway through the session and you don't want to miss out on what we're covering, you will get access to this recording tomorrow. So we always send out a link to the recording 24 hours after the webinar, along with a survey for feedback. We love to hear what you guys think about this information, the way it's presented, and what you want to learn more about. I think that's a very important part of this program. So we are starting with the very first webinar of the year. We're talking about Nourish to Flourish. So the role of anti-inflammatory nutrition, something I personally believe in. I'm such an advocate for nutrition. I think working previously in this space as a nutritionist, I've seen the impact it has on people's health and well-being and the role it plays in ongoing disease management. And I'm just such a big believer in the power of nutrition. So I could talk for days about it, and that's why I will stay on the line after this webinar finishes and we can have more of a chat about it if you're interested. So we'll start with a acknowledgement of traditional owners. I would like to acknowledge the traditional custodians of the land on which we meet today and pay my respects to their elders past and present. Just a disclaimer about the information we provide. We do our best to make sure everything we share with you is evidence-based, it's up to date, it's current. And so we're not intending to substitute any individual treatment advice. I will always direct you to your GP or your primary healthcare provider. But I will do my best to help you out with any questions you have if they're relevant to the content we're sharing today. So just today, we're going to go through what inflammation is and how it relates to arthritis, something that's very important when it comes to management. We're going to talk about foods and nutrients and what makes up an anti-inflammatory eating pattern. Key word there is patterns, and I'm going to come back to that and explain why it's so important. And then, of course, it's well and good to go through theory and the evidence, but I like to focus on practical tips and information and help you be able to build simple, balanced meals that support your health goals. So we'll focus on that. Just a quick question I'm going to put out to everyone. Do you feel more confused or confident about food and inflammation? So I'll give you a minute or two to just pop your thoughts in the chat here, because I'd love to see where you stand on this. We've previously done some webinars focusing on anti-inflammatory nutrition. So if you've been to those before, I'd love to know if you feel a bit more confident in it or you're still not sure, and want more information to help you build your knowledge. Okay. Yep. Lots of confusion. And that is so fair that it nutrition is a confusing science. It's complex, even for people with the health literacy and nutrition literacy, it can be confusing. There's a lot of research out there, and there's a lot of contradictory statements and opinions when it comes to what we should be eating or what we shouldn't be eating. So why don't we start with some background and context? What is inflammation and how does improving diet make a meaningful difference to arthritis symptoms for people? And so I want to take you to what makes up a joint. When you think about a joint structure, it includes bone, cartilage, ligaments, muscle, lots of connective tissues. But when we break those tissues down, many of the building blocks actually come directly from the diet if you think about it. So, bone and cartilage, for example, rely on nutrients like calcium, vitamin D, vitamin K, phosphorus. Boron is something that's really important for rebuilding bone. Bone, you have muscle, which is essential for supporting and protecting joints. That's largely made from protein. On the other side of the equation, we have inflammatory substances and hormones that can directly and indirectly affect joint health. So we know the production of many inflammatory compounds are influenced by lifestyle habits, and they can be aggravated by what we're eating. So this is where we're talking high intakes of added sugars, trans fats, ultra processed foods, regular alcohol consumption. Sorry, I'm just going to let some more people into this space. So all these foods that we talk about don't just affect the inflammatory load in the body, but they can also affect things like body weight, cholesterol levels, blood sugar levels, all which can place extra stress on joints, bone health, increase the risk of other conditions like heart disease and type 2 diabetes. And then if we go even deeper than that, at the cellular level, they can also interfere with how joint tissues function and repair. Some inflammatory molecules have been linked to fluid changes inside the joint, which can lead to swelling and stiffness. It can increase the risk of abnormal bone remodeling, which can contribute to some of those physical changes we see in arthritic conditions. So, based on our current evidence, we are learning that disease activity and symptom severity can be influenced by what we're eating. And so, when key nutrients like vitamin D, vitamin K, or calcium are lacking, we know this can increase the risk of our bone health. In conditions like rheumatoid arthritis and other inflammatory forms, we get a lot of questions like, can our diets cause these diseases? I want to say that diet alone can't prevent the disease or stop flares from occurring, but we do have a lot of growing research that shows us improving the diet quality could help with other things like reducing flare severity, supporting medication effectiveness, can help with managing fatigue, and just improving that overall quality of life. So the thing about inflammation is it doesn't just happen in isolation. It's influenced by everyday factors. So what we're eating, how much we move, how much muscle we have, how well the metabolism is working. So we know that when people are less active, regularly eat more energy than the body actually needs and have that all paired with a lower quality diet, it's these kind of behaviors that can cause changes, and these changes are cumulative, meaning they can have longer term impacts. So when we look at how diet and weight affect arthritis, there's two key pathways we're talking about. So the first is mechanical. So we know being overweight can affect our skeleton in many, many ways, but especially the joints. So excess weight is known to affect symptoms, particularly in those load-bearing joints like the knees, hips, ankles, and lower back. And it's over time, this mechanical stress, it doesn't just cause discomfort, but it can affect joint structure and the surrounding tissues. It can make them more vulnerable to injury and raise the risk of fractures and changing the shape of the bones and so on. You also have the inflammatory pathway. So inside the body, our fat tissue isn't just energy storage as it's once been made out to be. It does act like a active endocrine organ. It has the ability to continuously release inflammatory molecules that disturb the normal balance between bone formation, bone breakdown. We know it can quietly affect the pain system. It can amplify pain. It can reduce bone quality. And this is how it contributes to those silent diseases of what we know to be osteopenia, osteoporosis, arthritis, more specifically osteoarthritis. And so what you can see here is how easy this can become a vicious cycle. So inflammation can lead to less movement. If you're in pain, I could understand why you're not as motivated to go hit the gym or go to your workout class or take the dog for a walk. With less movement over time, that can lead to your muscle loss and weakness. Less muscle makes movement harder and more painful, and that feeds back into low activity levels, poorer metabolic health, and the worsening symptoms. So again, this is why nutrition matters so much. It's not just from that weight management perspective, but we do know some dietary patterns can either increase or reduce inflammation in the body. And we know a healthy dietary pattern can absolutely play a role in symptom management and disease progression. So we get asked a lot, is there a special diet? I'm sure many of you have had this question before. Is there a special diet we can follow for arthritis? The simple answer is no. But while there isn't a specific arthritis diet or a magic food that can directly treat the condition, eating well can still make a really big difference. especially in how you feel, how you function. And it's really important that we're considering where the evidence reliably points and the impact it could have on you. So, consistently across our literature, in some of the clinical guidelines, you will see different levels of recommendations for the following dietary patterns we've listed here. In rheumatoid arthritis, we do see recommendations for omega-3 supplementation, aiming for healthy weight management, and of course, strong recommendations to cease smoking and limit alcohol intake. That's due to the risk of interactions with medications, and I'll come back to that shortly. For ankylosing spondylitis, across the literature, you will see general recommendations for reducing meat intake, ensuring sufficient vitamin D and calcium intake. That's for bone health. It's also something many people are deficient in, and also increasing fish and vegetarian meals. On to the latest recommendations for osteoarthritis. So, if you look at the most current and up to date clinical guidelines, we see strong recommendations for healthy weight management. So, what you can see here is it's quite limiting in terms of what diet to actually follow. What do we actually eat when it comes to the management of our arthritis? So it's not that we have no research or a lack of it. We've actually got heaps of research. There's an abundance of research. It's just having the high quality, rigorously designed studies and the data available for that is a bit limited. But we have dozens of high quality clinical studies that explore the relationship between nutrition and arthritis, along with a large body of observational research. And what we know is the evidence consistently shows that gradual sustainable weight loss, supported by balanced nutrition, adequate protein intake, and regular resistance exercise, can help with not only improving joint health, joint support, but can help with the inflammatory load of the body. Research also points a lot to supporting bone health, particularly in rheumatoid arthritis and ankylosing spondylitis management. So, this is why it's really important we're considering vitamin D and calcium intake, and where it's appropriate, discussing bone density testing with your healthcare provider, especially for people living with obesity or central weight gain, people who might be unknowingly at risk of fractures. People living with rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis already have a higher risk of osteoporosis, which is when the bones become thinner, more fragile, and likely to fracture. So just making sure you're getting enough calcium and vitamin D, it can help protect your bones and then indirectly help with the management of arthritis. I also have growing interest in a lot of supplements, and we will cover this in a separate webinar down the track. But omega-3s, vitamin D, curcumin, collagen, all supplements which I'm sure you've heard about and you've seen them on the shelves with some promise around joint health and joint support. So some of the research shows a lot of promise with evidence linking these directly to improvements in pain, inflammation, physical function. The research is still quite mixed and in many cases inconclusive, but it's getting stronger. It's still promising. So when people talk about an anti-inflammatory diet, there's many different iterations, but mostly they're referring to a broad set of principles rather than a singular eating plan. So if you jump on Dr. Google, you type in anti-inflammatory nutrition, I'm sure you're going to come across many different search results with some very strict dietary patterns. So some dietary patterns might contain very rigid rules about what to eat, what not to eat. Others take a more flexible lifestyle-based approach, which focus more on the foods to include as opposed to foods to eliminate. So we do have good evidence that a healthy, balanced diet can support inflammation. We don't currently have strong evidence that suggests one specific diet reliably targets the inflammation to manage our symptoms. So we do have strong agreement on core principles of an anti-inflammatory way of eating, and I will be running you through what they are. You can think about how that could fit in your life on an everyday basis. So, if we delve deeper into the role of specific nutrients, because this is where a lot of the interest lies, we do see special mention of the following here. So, starting with protein intake, we all need it. So, if you're not familiar with protein's role in the body, protein is essential for our bodies to grow, repair, and function. It plays those key roles in building and maintaining muscle, which becomes increasingly important for metabolic health as we get older. If our protein intake's too low, that's when we start to see muscle loss occur more quickly. Less muscle around a joint, particularly the knees, means that a joint has to absorb more load, more force. This can feed into the vicious cycles of pain and reduced function. If we're exercising, especially doing strength or resistance work, our bodies need enough protein available to support that repair and adaptation. So it's not just about including protein in the diet, maybe having some eggs for breakfast and chicken for dinner, but the general guidelines suggest getting around 0.75 grams to 0.84 grams of protein per kilogram of body weight per day. That's a bit of a tongue twister. So, this is why it's really important you have conversations with your GP or a dietitian if that's available to you, because it's about ensuring that intake is adequate and meeting your needs. Everyone has individual needs and requirements. Some of the research suggests specifically for arthritis, getting an even higher intake in, and that could be beneficial if you live with a chronic condition. But because these needs vary so much from person to person, this is why it could be very beneficial to have a conversation with a dietitian. Onto your omega-3 fats, which I'm sure you're familiar with by now if you've gone down the rabbit hole of anti-inflammatory nutrition. Omega-3 fat, tongue tied there. Omega-3 fatty acids are a type of fat that's found in fish, nuts like walnuts, seeds like chia seeds, and other foods. You might see fortified milks and eggs with high vitamin D concentrations. But your omega-3s are known to lower inflammation in the body. The two most important omega-3s are actually EPA and DHA. So you'll see those listed and highlighted on a lot of supplements. It's because these fats directly help switch down the inflammatory pathways in the body. So oily fish such as salmon, herring are very rich in EPA and DHA. And across the literature, this is where you will see a lot of the research being done. A lot of the studies do focus on supplementation, though. We have actually over 40 clinical trials that support the role of high dose fish oil, suggesting it can weaken the immune inflammatory joint pain and stiffness symptoms of rheumatoid arthritis specifically. There's some research to support its use for psoriatic arthritis and ankylosing spondylitis, but taking a high dose for 2 to 3 months is linked to a favorable benefit in rheumatoid arthritis. We don't have the same research that's available to support its use for osteoarthritis, but given they are mostly safe to take, we see a favorable message around them, generally speaking. So, as long as you consult with your doctor or pharmacist before having major surgery, or if you're taking warfarin, that's where you need to use a lot of caution. But from a research perspective, omega-3s do offer modest symptom support for most people. They're just not a standalone treatment. Finally, we're seeing growing evidence that links vitamin D status with arthritis severity. So, vitamin D is very unique amongst all our dietary vitamins, as the main source doesn't come from food. So, if anyone knows where we get our main source of vitamin D, it's from the sun. But we can get some vitamin D from foods like eggs, milk, fish, particularly salmon. It's not nearly as much, but this vitamin is synthesized in the skin, the kidneys, and liver. So, low vitamin D levels have consistently been associated with greater pain, worse physical function, and higher levels of inflammatory markers in arthritis. We can't say that vitamin D deficiency causes worsening in arthritis symptoms, but it is notable. So this is particularly relevant for older adults as vitamin D deficiency, it does become more common with things like reduced sun exposure, changes in the skin synthesis, and also dietary intake. But given its role in bone health as well as calcium, just making sure sufficient intake, whether it be through food or supplements, it should be considered a more important part of your general joint health management, especially to help minimize the risk of bone and structural changes in general that are more and more common as we get older. The good thing about vitamin D and calcium is that the levels in the body can be measured by blood tests. So it makes it really worthwhile to have a chat with your doctor and see where your levels are at and make sure you're getting enough. So we have some research from 2023 to the level of a meta-analysis that includes 8 randomized controlled trials that found vitamin D supplementation slightly improved knee pain, physical function, and reduced synovial fluid in those with osteoarthritis. So that was interesting. It's more relevant in the context of rheumatoid arthritis because we have another 2020 meta-analysis among people with rheumatoid arthritis that found no overall significant reduction in pain scores with vitamin D, but the subgroups receiving a really high dose, so over 50,000 international units, over 12 weeks, had pain scores that were reduced significantly. What this told us was that dose and duration absolutely matter in the context of vitamin D and arthritis management. So these are promising findings. If we consider this in the context of daily arthritis management, for osteoarthritis, vitamin D correction remains best seen as an adjunct that might slightly reduce pain and improve function. We know it can help muscle strength and balance, and that indirectly helps the joints. For rheumatoid arthritis, vitamin D repletion can also be considered supportive of disease control and immune regulation. It shouldn't replace your regular treatment and your DMARDs or biologics, but it could sit alongside your current treatment. Although we say the science is nowhere yet solid enough to really blame or hero any singular food as being a key inflammatory or anti-inflammatory agent, we do know that a very high intake of ultra-processed foods coincide with the risk of developing or worsening a number of health issues. So you've probably heard a lot of chat around ultra-processed foods. I'm interested to hear from you guys, and if you can write in the chat box what comes to mind when I say ultra processed foods, I'd love to kind of get a sense of what you know about these takeaways. Absolutely. Fast food, confectionery, biscuits, cakes, the yummy stuff. So a lot of these foods do also extend to include processed meats, particularly deli meats, convenience foods. You can find high levels of saturated fats in full fat dairy products, butter, animal derived fats. Think processed goods, particularly baked goods. Foods which are high, generally speaking, foods which are high in saturated fats, trans fats, added sugars, salts, flavors, foods that might have longer shelf lives. But while we don't need to remove these foods altogether from the diet, it's just good to be aware of how these foods might affect you and hinder any progress you're making when it comes to symptom management. And again, it's all about context here. So you do have to consider things like how frequently do you consume these foods every day, or how few plant-based foods coming into your diet in comparison. So if we consider the whole diet, it's not that saturated fat is bad. It's just too much of it can potentially aggravate the severity of symptoms. So several studies have examined the effect of high fat, high carb diets on joint health. There was one interesting study that followed over 2,000 participants for 4 years, and they investigated the relationship between saturated fat intake and knee joint space loss. What researchers found was that um, the participants consuming the highest amounts of saturated fat experience greater radiographic progression of osteoarthritis in the knee compared with those consuming the lowest amounts. In fact, the findings suggested a diet high in saturated fats was associated with a 60% high risk of osteoarthritis progression. And this research was interesting because it suggests that osteoarthritis is more than just that wear and tear idea. It might be influenced by more metabolic and dietary factors. So it highlights that important role of diet in joint health. Similarly, recent research using data from over 11 million US adults showed that eating too much added sugars could increase the risk of osteoarthritis. So people who had the highest sugar intake had a 40% higher chance of developing osteoarthritis compared with those um, of the lowest intake. So, interestingly, this risk was especially higher in women, people with lower body weight, and those without common health conditions like diabetes, hypertension, or the history of smoking and drinking. So, the studies reinforce the message that cutting back on sugary drinks, sweets, desserts isn't just good for achieving a healthier weight, but it could help protect your joints too from that metabolic perspective. So while more research is needed to confirm the causation, it's just another reason to keep those added sugars, saturated fats in check as part of an arthritis-friendly lifestyle. And then we have weight gain. So this is where we see the strongest links in osteoarthritis research. We know that for every extra kilo over your healthy weight, produces an extra produces 4 times extra force on your joint load. So even modest weight gain in adulthood has been associated with more pain, more stiffness, reduced function, and actual structural changes, particularly cartilage loss. So not only does this increase that likelihood of needing a joint replacement down the track, but it could hinder any kind of benefit that could come from having the surgery. So this is why you see a lot of emphasis on healthy weight management, not just for the prevention of osteoarthritis worsening, but for better surgical outcomes. Because if that's the route you go down and that's the pathway you take, you want to make sure that your joint replacement works and you get the best outcome possible. So the big takeaway here is that it's not about cutting everything out, following really strict food rules. It's about knowing what supports your joint. So supporting your joints by reducing excess intake of saturated fats, added sugars, looking at reducing them where you can, focusing on habits that support and maintain a healthy weight. And it's about the small sustainable changes that make a real difference to how your joints feel and function over time. So the last piece of the puzzle is actually alcohol, and it's a really important piece of the puzzle, one that's often underestimated. If you are taking any medication, that includes over-the-counter pain relief, it's so important to have a conversation with your pharmacist and GP before drinking. So alcohol can amplify the effects of many medicines. In some cases, it can reduce the effects of medications. So when alcohol is combined with certain arthritis medications, not only does it reduce its effectiveness and how it works to manage your condition, it can increase irritation to the gut. It can place extra strain on major organs such as the liver and kidneys. And over time, this is going to raise the risk of more serious side effects, not just discomfort. So we know that people living with osteoarthritis, spondylitis, are already at high risk of osteoporosis, and drinking more than 2 standard drinks per day just further increases that risk of weakened bones, which is the last thing we want when we're trying to protect our joints. And then to complicate things further, We know alcohol can interfere with nutrient absorption and so can damage the lining of the small intestine and the stomach, where most of your nutrients are absorbed. So we know fatigue is already a major challenge for many people living with chronic pain and inflammatory condition. And if you have poor absorption of these key nutrients, especially B vitamins, that can make the energy levels even harder to manage. And so, just briefly on NSAIDs, so you might know this as Nurofen, very common and often necessary for acute pain relief. While it can be effective in a short term, long-term use can irritate and damage the gut lining. So it's important to not overlook your gut health. So including gut supportive foods where you can, like yogurt with live cultures, something paired with banana can help support gut health and reduce some of that impact. Something which I'll talk a little bit more about next week when our focus is plant-based foods. So an anti-inflammatory diet, I was saying, it's not about saying one food is good, one food is bad, or dismissing the benefits of certain foods altogether. The research really shows us that it's far more helpful to look at the overall pattern rather than focusing on single ingredients or the so-called superfoods. So it's not about just smashing the apple cider vinegar on an empty stomach or smashing those goji berries. It's about the pattern in which you're eating all your foods. So, a balanced anti inflammatory eating pattern includes plenty of colorful vegetables and fruits, whole grains, healthy fats like olive oil and avocado, oily fish such as salmon and sardines, nuts, legumes, herbs, and spices. At the same time, it does tend to limit those highly ultra processed foods, added sugar, large amounts of red meats or deli meats. And instead of narrowing in on one food, it's way more helpful to focus on the principles and targets. Things like getting enough quality protein in, choosing high fiber carbohydrates, including healthy fats, and aiming for a balance across all the food groups. If we're narrowing down the key ways our diet can support joint health and reduce inflammation, I like to focus on the practical tips and how you can actually achieve this. And firstly, we can focus on those anti-inflammatory fats. So these are mainly your omega-3s, which you find in your oily fish like salmon, anchovies, sardines. You can use the SMASH framework, which I love to use. So, salmon, mackerel, anchovies, sardines, and herring. It's also about the nuts and seeds, so walnuts, chia seeds, flax seeds. You can find these also in fortified foods like eggs and milk as well. So a simple goal here could just be about aiming to include fish twice a week, which it could be enough to start seeing benefits. As for fiber and plant compounds, these mainly come from your vegetables, your fruits, legumes, nuts, seeds, and whole grains. So one practical target to include a wide variety. Aim for 30 different plant foods across the week. So I aim for 5 different plant foods every day. It's this variety that can really help support your gut and overall health. Your bone and muscle support is also essential. So this means including your low-fat dairy, other calcium-rich foods, lean protein sources 2 to 3 times a day. Calcium, vitamin D, protein, these are essential for your muscle strength and keeping those joints supported. Can make a huge difference to your ongoing management. And then finally, antioxidants, something that we talk a lot about in arthritis management. These are essentially found in all your colorful foods. Think berries, leafy greens, certain spices like turmeric and ginger. Personally, I like to use herbs and spices instead of salt or sauces. Not only does it bring a lot of flavor to your dishes, make them more tasty, but it adds that health benefit. It boosts the antioxidant profile of a dish. They're very versatile, and you can experiment with these as you please. So they can be generally um, they can fit into your daily dietary pattern quite nicely. So, a Mediterranean style diet, which I'm sure you've heard about before as well, would be one such variation of an anti inflammatory diet with a strong focus on fish, extra virgin olive oil, and pairing of foods to increase nutritional value. For example, something you see a lot in Greek dishes or Italian dishes is that the tomatoes are cooked in extra virgin olive oil. So not only does that make for better flavor, but it immensely boosts its antioxidant profile, makes antioxidants more bioavailable in the body, makes it more powerful. And then you see a lot of emphasis on herbs and spices instead of salt. You see the pairing of legumes and grains, which immensely boosts the protein content of a meal. So, this Mediterranean is the diet that's backed by the most evidence, which is why you see so much advocacy around it, especially in the heart health space. So, it doesn't just support joints, and that's not just backed by evidence. It helps nurture your gut, reduce inflammation, and strengthen the immune system. And it does this through its fiber, polyphenols, prebiotics, and probiotics. Fermented foods like yogurt and kefir are known to introduce beneficial bacteria and produce short chain fatty acids. So we know these have powerful anti inflammatory effects. Extra virgin olive oil is packed with omega-9 fatty acids, and these offer different health benefits again, like improving your cholesterol balance by lowering the bad cholesterol and maintaining that good cholesterol. It's also known to protect blood vessels, which is particularly important for type 2 diabetes. And finally, it's packed with all your colorful fruits and vegetables, which bring key vitamins and minerals in for your general health. So even foods rich in tryptophan, which I won't get into today, but foods like nuts, seeds, fish are very beneficial, not just for general health and gut health, but mood and serotonin production, making them very valuable for both mental well-being and broader hormonal balance. So we could go on about the benefits and evidence behind this diet, but what's really important to take away from it is that it's largely about its composition. So the good news here is that it's not about being perfect to see those benefits. You can start with the small practical changes. So using olive oil as your main added fat, including vegetables at every meal, experiment with the herbs and spices as opposed to sauces. Aim for legumes just a couple of times a week. Eating fish or seafood a couple of times a week. Swap in those whole grain breads, replace the white breads. Choose chicken and meat less often. Have fresh fruit daily. Include fermented dairy products. Enjoy a handful or two of nuts each day. That even just picking a couple of these steps to start with can make a real difference. So I love to talk practical examples. I think it's good to go through theory and evidence, but it's also about what you can walk away with and what you can do in your own home environment. So I like to demonstrate a day on the plate, and it's good to have examples to follow. So all these recipes you're seeing here are actually pulled from the Heart Foundation, which has a great database of recipes, very Mediterranean style recipes. If you're signed up to our e-news, you'll occasionally see a recipe come through again. But you can see here, a breakfast might be overnight oats with fruits and seeds. It's packed with the fiber, antioxidants, and makes a great start to the day. You have lunch, a lean turkey burger with salad or veggies, which is packed with the proteins to support those muscles and joints. You have dinner, which could be my personal favorite, a Spanish fish stew. It's packed with fish, veggies, and flavor, which is important. No one likes to eat boring foods, but it's also loaded with the omega-3s, the protein, and antioxidants. So the key here is really small, realistic choices. A slippery slope for many people is the snacking. That's where I find a lot of people get caught up. And so snacks could be fresh fruit. It could be a handful of nuts or seeds. It could be those high protein yogurts you see marketed everywhere. Super easy ways to keep the energy up and your body nourished. So it's just these little things you can do that can make a big difference. And then closely following the Mediterranean diet research, we have the blue zones. I'm not sure if anyone's familiar with this or heard about it before, but your blue zones are dietary patterns that are based off the research that looks specifically at locations like Icaria, Okinawa, Sardinia, Nicoya, Greece, Loma Linda. It shows that people there well, people living in these regions tend to live longer. So they've always wondered why this is, but not only are they exceeding the life expectancy rates, but they are able to stay mentally sharp and remain active in their communities. The experts have linked this mostly to their plant-based diets that they follow, but also the regular movement and strong social connections. So basically, those healthy habits paired with supportive communities. I won't be spending too much time talking on this today because I will focus more on it in our next webinar. But for joint health, you can take inspiration from this way of life with the simple practical steps, like including those lentils and chickpeas, black beans, soy at 1 or 2 meals each day. You can think soups, stews, vegetable bean bowls, making breakfast and lunch larger meals, keeping dinner lighter, serving slightly smaller portions, eating slowly and stopping when you feel comfortable, um, enjoying sweets or refined snacks only occasionally. So it's very simple adjustments. Not only are these conducive with healthy weight management, but they have some kind of benefit to help all things that make living with arthritis much easier. So, what are our next steps? You can join our next webinar where we do focus more on gut health. We focus on the blue zones and plant-based eating patterns. When I say plant-based, it's not just about vegan dietary patterns, vegetarian diet patterns. It's about including more variety of plants into your way of life. Downloading Clara, we had someone who said it really works for them and helps them. You can pop in any question about your current diet or what you want to start doing more of, and it should link you directly to some nutrition information, tips, and resources. And then if you're not subscribed to our e-news, you can absolutely subscribe to that for more advice. Again, we post recipes in there and often a lot of nutrition information. So, in summary, there isn't any special diet for arthritis, but improving the overall nutrition definitely has a powerful impact on symptom relief, prevention of complications, and quality of life. And it's about aiming for variety, color, and minimally processed foods where possible. You don't have to be strict or rigid about it, but it's about finding a way of eating that works for you as well. So, thank you for listening today. We do have a couple of minutes to revisit some of the questions that have come through in the chat box. I will be stopping the recording here and then open up the floor to discussion. There we go.